Hello everyone, I'm Fatma Said Suleiman, roll number 46. And today in this presentation, I'll be talking about concept of community health. So by the end of this video, you'll be able to know what is health, what is community health, and what are different concept of community health and how they interrelate with the community. So stick around to the end of this video. Now starting directly on what is health. Health has been defined by the World Health Organization as a complete state of physical, mental, and social well-being, and not just the merely absence of any disease. And the fundamental goal of the medical science is to make sure and maintain the optimum health of an individual for as much as possible and as long as they live. So maintaining that health is what the goals in health organization and health centers. Okay, now moving on the community health, we know that in our community, people are faced with different conditions, including cardiovascular diseases, diabetes, and cancers. So all of these diseases now will help us to understand community health. According to WHO, community health, it refers to the health status of the members of the community to the problem that they are facing to their health and the totality of the health care that are provided to the community. So different community have different capability on taking care of the needs and the health of the individual within their community. Thus, we see some community have more people who have cancer, or some community have more people who are prone to cardiovascular diseases. All of this based on the community area in which they live. Now moving on onto the concept of community health, they are four. These are preventive, promotive, restorative, and rehabilitative. Now we can see each one by one and how they interact with the community. Okay, now moving on with preventive. Preventive is divided into three: primary, secondary, and tertiary preventive. So starting with the first one, that is primary preventive, these are the all measures and intervention taken before the onset of a disease. For example, immunization to an infection, or chlorination of water, or patching the potholes within the road to prevent an accident. All these are considered in primary intervention. So then they are generally to improve the life of a person. Secondary interventive, these are all measures that are taken to arrest the progression of any diseases while it is in early stages in which it is asymptomatic of stage of the diseases. So it involves early diagnosis of the diseases and the treatment. So all the intervention that can be done before any symptoms have happened, it is in the secondary preventive. Tertiary preventives are all measures that can be taken in order to minimize the consequences of a disease or an injury that had happened before. So it involves, for example, let's take an example of a paraplegic patient or quadriplegic patient. So they are not able to move, but placing them and changing them position every time, so we'll be able to avoid what? Pressure sores or contract that might happen. Okay. The second concept of community health is promotive, and this focuses mainly on emphasizing on the primary prevention, promoting people better lifestyle, emphasizing people to look at their health, to look at their diet, to look at their weight, and what are measures to take in order to have healthy lifestyle within the community. So all these measures that are taken to emphasize people are what promote healthy lifestyle within the community. Telling people to look at their healthy, to go to hospital to get checkup or different when see something isn't right and so on, and have also having regular checkup. Preventive practice are all practices that can be used in order to restore the initial functioning of an individual, in order to maintain the highest level of functioning of an individual physically, mentally, and social well-being. So they involve addressing of the situation, resolving conflict, reducing and prevention of harm, building healthy relationship between individuals. Okay, now moving on with the last one, which is rehabilitative. These are all set of interventions that are designed to optimize functioning and reducing disability in an individual with a health condition in interaction with their environment. For example, we can take paraplegic patient or a patient who has been amputated